This medication is used to treat severe ongoing pain. Methadone belongs to a class of drugs known as opioid analgesic. It works in the brain to change how your body feels and respond to pain. Do not use this medication to relieve pain that is mild or that will go away in a few days. This medication is also used to treat addiction to opioid or as part of an approved treatment program. It helps prevent withdrawal symptoms caused by stopping other opioids. How to use? Read the medication guide provided by your pharmacist before you start using this medication and each time you get a refill. Take this medication by mouth on a regular schedule as directed by your doctor, not as needed for sudden pain. You may take this drug with or without food. If you have nausea, it may help to take this drug with food. Ask your doctor or pharmacist about other ways to decrease nausea. If you are using liquid form of this medication, carefully measure the dose using a special measuring device. If you suddenly stop using this medication, you may have withdrawal symptoms, especially if you use it for a long time or in high doses. To help prevent withdrawal, your doctor may lower your dose slowly. Tell your doctor or pharmacist right away if you have any withdrawal symptoms such as restlessness, mental mood changes, watering eyes, running nose, nausea, diarrhea, sweating, muscle aches, or sudden changes in behavior. Though it may help many people, this medication may sometimes cause addiction. The risk may be higher if you have a substance use disorder. The dosage is based on medical condition and response to treatment. Take this medication exactly as prescribed to lower the risk of addiction. Ask your doctor or pharmacist for more details. Side effects: dizziness, drowsiness, lightheadedness, nausea, constipation, vomiting, dry mouth, and sweating. Some of these effects may decrease after you have been using this medication for a while. If any of these effects persist or worsen, tell your doctor or pharmacist promptly. To prevent constipation, eat dietary fiber, drink enough water, and exercise. You may also need to take laxative. Ask your doctor or pharmacist which type of laxative is right for you. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. Remember that your doctor has prescribed this medication because he or she has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Tell your doctor right away if any of serious side effect occurs, including interrupted breathing during sleep, mental mood changes, stomach abdominal pain, difficulty urinating, signs of your adrenaline glands not working well. Get medical help right away if you have very serious side effects including seizure, severe drowsiness, and difficulty in waking up. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of rash, itching, swelling, severe dizziness, and trouble breathing. However, this is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Precautions: before taking this medication, tell your doctor or pharmacist if you are allergic to it or to other opioid or if you have any other allergies. This product may contain inactive ingredients which can cause allergic reactions or other problems. Talk to your pharmacist for more details. Before using this medication, tell your doctor or pharmacist your medical history, especially of brain disorder, breathing problems, kidney disease, liver disease, mental mood disorder, personal or family history of a substance use disorder, stomach intestinal problems, difficulty urinating, gallbladder disease, and disease of the pancreas. Methadone may cause a condition that affects the heart rhythm. QT prolongation can really cause serious fast, irregular heartbeat and other symptoms that need medical attention right away. The risk of QT prolongation may be increased if you have certain medical conditions or are taking other drugs that may cause QT prolongation. Before using methadone, tell your doctor of all the drugs you take or if you have any of the following conditions, including certain heart problems and family history of a certain heart problems. Low level of potassium or magnesium in your blood may also increase your risk of QT prolongation. The risk may increase if you use certain drugs such as diuretics or water pills, or if you have conditions such as severe sweating, diarrhea, or vomiting. Talk to your pharmacist about using methadone safely. This drug may make you dizzy or drowsy. Do not drive, use machinery, or do anything that needs alertness until you can do it safely. Limit alcoholic beverages. Some product may contain sugar and alcohol. Caution is advised if you have diabetes, alcohol dependence, liver disease, or any other condition that requires you to limit or avoid these substances in your diet. Before having surgery, tell your doctor or dentist about all the products you use, including prescription, non-prescription, and herbal products. Older adults may be more sensitive to the side effects of this drug, especially confusion, dizziness, drowsiness, QT prolongation, and slow and shallow breathing. During pregnancy, this medication should be used only when clearly needed. Discuss the risk and benefit with your doctor. This medication passes into breast milk and may have undesirable effects on our nursing infants. Tell the doctor right away if your baby develops unusual sleepiness, difficulty feeding, or trouble breathing. Consult your doctor for more details.